On that note, I yield to the representative from the area.
Thank you, Mr. Chairman. Mr. Chairman, I'm very glad to hear today from the GAO that we have been using the money responsibly, because traditionally we have had some negative images with respect to how money were being spent. With that being said, I was a little bit disappointed, Dr. Perry, Career Perry, to hear that there are $4 million for mental health that are left unspent by the city, and you come here to testify of mental health needs. Can you explain with respect to that discrepancy?
Yeah. We don't have money for mental health in the city.
I'm sorry?
We don't have a mental health grant for the city.
I've received information from very secure sources that the city does have $4 million in mental health money left unspent.
I'm not sure.
But can you look into that, if you don't mind?
Yeah. It might
Or
be
Mr. Williams, do you have any comments with respect to that?
Yeah. I believe it would be a strange coincidence if it wasn't if this wasn't the $4 million carve-out from the Primary Care Access Stabilization Grant that was specifically earmarked for the City of New Orleans Health Department to address not just mental health, although that's an allowable expenditure of the primary care grant funds, but also to address healthcare needs in particularly underserved areas, and to provide the dental services which are up and running. They got off to a slow start spending that money, but they're well underway to make good use of it at this point, as far as I know today, and we can get you more information.
So of the $4 million, which portion of it was spent on mental health, which portion of it was spent on the dental trucks?
Yeah, when we applied, we didn't apply specifically for mental health. We could use it for dental and for the New Orleans East Clinic. So we've spent it on dental and New Orleans East Clinic. So we are on track to spend all of our allocation by the end of the grant. We will have no money left.
Okay. Dr. Brand, I was looking at some of the grant allocations that HRSA has granted to the area, and I've noticed that a large portion of it were concentrated in the downtown and uptown area, where the areas around the fringes, the New Orleans East area, St. Bernard, those areas in Wagaman, in West Wego, there have been very little being done for those areas. Can you address that, please?
Certainly. I believe that Administrator Wakefield has begun dialoguing with you and your staff about the fact that those areas do not have ready access to federal qualified health centers. We continue to work with the Primary Care Association to look at those areas where we might, should resources be made available, do a new expansion or provide a new access point. There will not be resources available for a cycle in 2010. We don't know what the situation will be for 2011 because that budget is still being developed. But certainly we will work with folks in that community. We'll work with the Primary Care Association to help an organization that's ready to stand up and be prepared to either be an FQHC or a look-alike. Be prepared. The other opportunity, should resources be available, is something called a planning grant that helps the community organize and be prepared to apply and perhaps be more successful in that application process.
Mr. Levine, I know that the state has a terrible FMAP problem. Can you please explain to us how would the FMAP problem affect the issue of the poor in the district? And also, I'd like to know whether or not the state has an audit system with respect to how money is being spent by the city as it comes down from the state.
Thank you, Congressman Gao. The FMAP problem is the single biggest problem our state faces right now with financing for the poor. We can't sustain nearly $1 billion a year reduction in our funding for Medicaid. It would trump everything, all of the progress that's been made here. Whether we talk about the expansion, I know there's a potential expansion of Medicaid in the reforms. In the House bill, it was 133%. In the Senate, it's 150%. For us to go from where we are today, where currently we have a $275 million deficit in our Medicaid program this year, into a situation next year where we face a $900 million shortfall, and then go into a period where we have to then do an expansion of Medicaid. It couldn't be done. The maintenance of effort requirements under the stimulus and then in both of the House and Senate bills would really put a lot of pressure on provider rates and really, I think, effectively make our program insolvent. And so we really need a solution to this FMAP problem. All of the good work that has been done, what we talked about earlier about potential solutions to the PCASG grant, for instance, allowing us to use CDBG money that's unspent, or applying for a DISH waiver that would allow us to use disproportionate share funding for community-based clinics. We can do those things, but we also have to provide state match. Well, with a decrease in federal match that we're facing, we're not capable of doing that. So I think the fundamental problems here are A, fixing the FMAP problem, B, acknowledging this DISH audit rule and the $250 million per year impact it's going to have on our state, in addition to the FMAP problem, and then third, the $30 million problem we're going to have when this grant runs out in less than a year. We have these are three converging factors that any one of which would be devastating, but all three of them are virtually impossible for the state to be able to overcome on our own.
And then does the state have an audit system to ensure that money is being spent by the city?
Well, as it relates to funds that come through the department, we
Right.
do. And we have an internal audit function. We also have the ability through our contract to review all such expenditures, as does the legislative auditor, I believe, have the authority to audit any grant funds that come through our department.
Could you provide us with a copy of the audit?
I'm sorry.
Could you provide us with a copy of the audit?
Sure. Now, I won't say that we have done any audits at this point? Yes. Yes. The answer is yes.
Mr. Chairman, if you allow me one more question. I know that Dr.
Extend the gentleman's time for another minute.
Thank you very much. I know that Dr. Korea Perry has addressed the issue of the New Orleans East and the lack of hospitals out there for New Orleans East and St. Bernard. Dr. Brand and Mr. Levine, is there any way both of you or both of your organizations can sit down and discuss the problem and come up with some kind of solution in connection with Tulane and LSU to see how we can address that particular need out there for approximately 120,000 people. 120,000 people right now do not have access to a hospital. I know I live out there in New Orleans East. About 2 years ago, I had to drive my father close to 40 minutes to get him to the nearest emergency room. He's a diabetic, and he has some complications, and we had to fight traffic, drive over the high rise, which for the people of New Orleans East almost serve as a psychological block for many of them. So if you could do that, I would really appreciate it.
I think the administration stands ready to work with the Congress, the state, and the local partners to address all service gaps, and certainly we'd be happy to meet with them.
Well, thank you very much. That's all I have, Mr. Chairman.